Hey guys, welcome to the first ever Ask Dr. V show. I am your host, Dr. Brian Burnett, and I am a chiropractic physician, a sports practitioner, and a wellness professional. And it is my passion and purpose in life to help educate, motivate, and inspire you to live your best life possible. So this is going to be a weekly show where we answer questions from our viewers. So today we've got a question from Chris, and Chris asked, what actually happens during a chiropractic adjustment? So this is a question that I get from a lot of my patients. There's a lot of misconceptions out there. Some people are scared of chiropractic adjustments. They think that the cracking is their spine breaking. Totally not true. Chiropractic is extremely safe. Our profession has been around for over 100 years. It was started in 1895 by D.D. Palmer. There's a ton of research to support chiropractic. A lot of research has been coming out very recently that I'm going to talk about today in today's episode. So when you hear the popping and cracking during a chiropractic adjustment, the term for that is called a cavitation. And let me explain what happens during the cavitation. So you have the vertebrae that come together, the two bones in your spine, and they form what's called a facet joint or a zygapophyseal joint that is surrounded by ligaments, a ligamentous capsule, and inside that capsule is fluid, very similar to your knee joint. You have a knee joint where the two bones come together, and in between there is fluid. Same thing in your spine. And when you get that stretch, when the joints aren't moving properly, it's called a subluxation. And when the adjustment takes place, you get a movement in that joint, and the synovium fluid releases carbon dioxide gases, which creates that popping or that cracking sound. It's not harmful at all. It's actually very beneficial for you. Most recent research that's come out in the last few years shows that when you get that audible cavitation, the joint actually releases a neuropeptide called substance P that has analgesic properties similar to morphine, that has ability to block pain fibers. So it's a very beneficial thing that happens. So that's a little bit scientific answer for what happens during the chiropractic adjustment. In a more simpler explanation, we're helping those joints to move properly. So there's no restrictions, making sure that the joints are properly aligned, and we're taking interference off of the nervous system so that the brain and the spine can send out signals to the body, to the muscles, to the organs, as well as receive those signals. So that's a very brief and simple explanation about what happens during a chiropractic adjustment. So I hope you enjoyed this video. If you have any questions about chiropractic, about back pain, about health, about nutrition, about exercise, please comment, put your questions below, and don't forget to like our video, subscribe to our channel, share with your friends, and we'll see you next week.